Quick question. What do you think is the most important public health device in your entire home? I'll give you a hint. It's not the medicine cabinet. Nope. It's your toilet, your sink, your shower. In this explainer, we're going to uncover why the person who installs all that is one of society's most vital and most unsung heroes. Let's dive in. So check this out. The plumber protects the health of the nation. That has been a motto in the plumbing industry for a solid century. Can you believe it? It started showing up on posters from American Standard way back in the 1920s. It's a really bold claim, a point of pride that stuck around for decades. But is it actually true?
And that's the core question we are tackling today. We're going to follow the trail through history and science to see if this old slogan really holds water. I have a feeling the answer might change how you look at the pipes in your walls forever.
To really get a grip on just how valuable plumbers are, we have to go back in time. We need to visit a world that, for the most part, didn't have them. A world where our biggest, most exciting cities were also our most dangerous biohazards.
Yeah, just take a look at this. It's a pretty grim picture, but this was the reality for so many people. In the 19th century, cities were growing so fast they were literally drowning in their own waste. You had cesspits overflowing right into the wells people got their drinking water from. It created this constant, horrifying cycle of diseases like cholera and typhoid. This was the reality that kept life expectancy brutally short before we had modern plumbing.
So how on earth did we escape that nightmare? Well, it was a revolution, and it was built on data and engineering. It really kicked off in 1842 when a guy named Edwin Chadwick published this landmark report that, for the first time, clearly connected disease to all the filth in the streets. That sparked new laws and, more importantly, this huge realization that separating clean water from wastewater wasn't just a good idea, it was a matter of life and death. And that's when the core ideas of modern plumbing were really born. And the impact? It was nothing short of miraculous. Seriously, putting in proper sewer systems and clean water infrastructure is often ranked right up there with vaccines and antibiotics in terms of its effect on our health. It didn't just stop a couple of diseases, it completely reshaped our society and dramatically boosted how long people could expect to live.
Okay, so that's the big picture history lesson. But how does all of that protect you right now in your own home? Well, it all comes down to a few simple but totally ingenious invisible shields.
Every single time you use a sink, you are counting on this little hero, the P-trap. You've seen that U-shaped pipe under the sink, right? Well, it's designed to hold a little bit of water after everything else goes down. And that small plug of water creates a physical seal, a roadblock that stops dangerous sewer gases and all the nasty stuff they carry from coming back up the pipe and into your house. It's such a simple, elegant, and life-saving design. In the P-trap, that's just one piece of the puzzle. A professional plumber is building multiple layers of protection. They're making sure the clean water coming in never ever touches the wastewater going out. That's a huge deal called a cross-connection. They install special devices to stop contaminated water from ever flowing backward into your clean supply. And in big buildings, they're designing complex systems to prevent the growth of really dangerous bacteria like Legionella. Now, it's easy to think, okay, we beat cholera and typhoid in most places, so the job's done, right? But the truth is, the threats have just evolved. The plumber's role today is arguably more critical than ever because they're fighting a whole new set of hidden dangers.
The whole game has changed. You know, the classic enemies were diseases from filth. Today's threats are a lot sneakier. Plumbers are on the front lines dealing with Legionella bacteria in our water heaters, lead leaching out of old service lines, those industrial forever chemicals we hear so much about, and even antibiotic-resistant bacteria that can thrive inside our pipes. The fight is still very much on. It's just happening out of sight. And here's what it all boils down to. You can have governments write safety codes and engineers design massive citywide systems, but it's the individual plumber who is the last line of defense. They're the ones on the ground, in your home, in your office, making sure those codes are actually followed and that the system works exactly how it's supposed to protect you. So after looking at the history, the science, and the challenges we face today, what's the final verdict on that 100-year-old slogan? Well, the evidence is pretty overwhelming. And it's not just about our health, it's about our wealth, too. Get this. The World Health Organization did the math. For every single dollar invested in sanitation and clean water, society gets a return of between $4 and $12. That's from savings in healthcare costs and from people being healthier and more productive. I mean, that is an incredible return on investment. Protecting public health with plumbing isn't an expense. It's one of the smartest investments a society can possibly make. So, let's ask it one last time.
Is the plumber protects the health of the nation just a clever marketing slogan? Absolutely not. It is a fundamental truth. For over a century, the quiet, daily work of plumbers has built and maintained one of the most effective public health shields in human history. It's saved countless lives, and honestly, it forms the very bedrock of our modern, healthy society.
And that kind of leaves you with a final thought, doesn't it? We've unmasked one silent guardian today. But who else is out there? Who are the other invisible protectors doing essential work that we rely on every single day, maybe without ever even noticing? It's something worth thinking about.